me, Jerusha.
Now, we know that much has been made of national health insurance in South Africa, but we also know that the medical community is really looking to government for some type of leadership or direction on this. And we know that the white paper on the NHI is something that really many people are waiting to see. Won't you give us your opinion and the opinion of your organization on this particular white paper?
Well, Jerusha, I mean, I think perhaps from the perspective of the South African Medical Association, we would have a far better, opinion if we actually had the white paper. So I wouldn't use the word opinion. I'd rather say the word speculation, because I think we're all sort of eagerly anticipating what is going to be contained in that white paper. I think most would recall that the so-called green paper on NHI came out roughly about 5 years ago now. So it's been a long time in the actual making, with the result that we effectively have gone through several of almost a preparatory phase of where we have been doing a couple of things as a country. One, the Department of Health instituted a number of pilot sites, so-called NHI pilot sites. There are 10 that are running at various capacities around the country. We've also had a number of interventions by government. You'll recall that the minister many years ago announced a so-called 10-point plan that government was going to tackle the public healthcare system and the healthcare system as a whole, with NHI being one component of that. But clearly it's the NHI component that has got everybody talking and somewhat anxious. And we've had that initial green paper that suggested a very broad framework, but was very, very scant on detail. And what the white paper will be doing is starting to fill in the gaps. It'll be putting the meat on the bone, so to speak, around the really important questions. And that's certainly what we hope to see. And I think those important questions include, number one, probably foremost on everybody's mind, how do we envisage as a country that we are going to fund the system? Because that is the pinnacle on which the entire system is going to rest. Second questions that we are concerned with as the medical practitioners, clearly a very important stakeholder and role player in that entire system, is exactly what role we are going to play. And when I say we, referring more specifically to those practitioners and those colleagues and members of ours who are in the private sector, how are they going to interact with the NHI system? Are they going to be contracted in? And already there are some contracts and there are some general practitioners who are already in these NHI pilot sites, already delivering services. But clearly we want to expand that and see how is that going to work, not only at primary care level, but at specialist care level as well. So there are many questions that need to be answered. But I think it's something we eagerly anticipate, because it's not only about us. And I think, clearly I'm sitting here speaking on behalf of the South African Medical Association, but it's a paper and a document that is going to affect every single South African. And I think every single South African needs to take time to look at that and try and use the mechanisms available to give the feedback, because about our future healthcare system in the country. And that's going to affect everybody, from the president to the person living on the street.